afternoon. My name is Mihika Mishra, and these are my colleagues.
My name is Amrita Venkat.
And my name is Aditya Dave.
As you all know, for the past 2 years, we have been living through a worldwide pandemic. However, an epidemic that has been often overlooked and has been rampant long before COVID is obesity. Over 1/3 of Americans are obese, and obesity impacts an estimated 500 million people worldwide each year. It is responsible for 4.7 million premature deaths per year and can cause a variety of health issues such as diabetes, coronary artery disease, and sudden cardiac arrest. A person's weight is classified based on the body mass index scale, which is calculated by their weight in kilograms divided by their height in meters squared. The resulting number puts their weight classification into one of 5 categories: underweight, ideal, overweight, obese, or morbidly obese. For a person to be classified as obese, they must have a BMI greater than 30, and for a person to classify as morbidly obese, they must have a BMI greater than 35. Of adults ages 20 and older in the United States, 42.4% were identified as obese, with 9.2% of those being identified as severely obese, with a BMI of greater than 40. Obesity can cause serious health detriments, especially to one's cardiac health, which is why we are creating new universal resources for BMI to improve heart health, so that everyone can live a happy, heart-healthy lifestyle. In order to understand how a disease impacts the body, it is important to first learn how it develops. My colleague Aditya will be diving into the pathophysiology of obesity so that we can not only learn how it develops, but some of the important impacts that it has on the body.
Thanks, Mihika. Obesity, by scientific definition, is a chronic inflammation in adipose tissue and a state of malnutrition by excess. Obesity develops from a chronic caloric surplus, meaning that at the end of the day, someone's energy intake is greater than their energy expenditure. Some of the key factors that can help lead to obesity are sociodemographics, things like your age and gender, cultural tendencies, socioeconomic level, and geographic distribution. Then there are lifestyle factors, your diet, smoking habits, the number of children you've had. Then there are genetic and family factors. An interesting fact about that is that humans have actually evolved the ability to deposit fat and use it during times of energy deficit. But this ability has actually turned into a detriment in today's developed society where overabundance and easy access to fast food is the norm. Lastly, there are nutritional factors. Macronutrient composition and caloric intake also affect how you can develop obesity. Obesity manifests itself in many ways across the body, but 2 of the most common ways it does in your cardiovascular system are in sudden cardiac death and atrial fibrillation. The structural changes in your heart cause a greater amount of prearrhythmic substrate to be generated and therefore put you at a higher risk for atrial fibrillation. Obesity also induces ion channel disorders and fibrosis in the heart, predisposing obese individuals to sudden cardiac death. Next, atherosclerosis, similar to obesity, is a chronic inflammatory condition. The increased fatty tissue releases adipokines and thereby facilitates the atherosclerotic process. Cancer is also another manifestation of obesity in the body. In a landmark study, researchers observed that with people with BMIs of 30 to 35, obese individuals had a 20% higher death rate, whereas those with 35 to 40 morbidly obese people had a 34% higher death rate when compared to people with normal BMIs. Lastly, obesity also accelerates type 2 diabetes and adds to your risk for coronary artery disease. A 10-kilogram rise in body mass is directly correlated to a 12% increase in your risk for coronary artery disease. It also raises your systolic blood pressure by 3 millimeters of mercury and your diastolic blood pressure by 2.3 millimeters of mercury.
Along with these health detriments, obesity can have a large impact on an individual's cardiac function. Obesity is often associated with left ventricular diastolic dysfunction as shown in many studies, which can lead to an impairment in the filling of the heart. Obesity is also associated with the hemodynamic overload, which is a surplus of blood in the body. This is caused because obese individuals usually have a larger left atrial size, which is correlated with filling size, therefore leading to this hemodynamic overload. This can cause a surplus of blood in the body or a hyperdynamic circulation, leading to health issues such as hypertension, which is often correlated with obesity, as you can see in the chart. Obese individuals often are associated with atrial and ventricular remodeling, which is changes in the size, shape, and structure of the heart. This can cause the heart to wear down and create more scar tissue, putting a patient at greater risk for sudden cardiac arrest. Along with this remodeling, it not only causes a physical change, but impacts the cardiac cells involved with diastole, meaning that as the heart fills, the heart can break down even more and put a patient at greater risk for myocardial dysfunction as the heart becomes extremely damaged. Both eccentric and concentric patterns of left ventricular hypertrophy have been described in obese patients where the left ventricle becomes thick and is unable to pump blood efficiently. This can lead patients to abnormal arrhythmias such as ventricular tachycardia and atrial fibrillation, and eventually sudden cardiac arrest.
To combat these health detriments, there are multiple treatment modalities for those who are overweight or obese. The most common is dietary modification. This includes a low-sodium diet, a low-fat diet, a high-protein diet, or a plant-based diet. It's important that patients are not malnourished, as malnutrition may lead to the reduction of cardiac output and predispose heart failure patients to further complications, including higher hospital readmission rates and mortality. Another treatment modality is weight control. Physical activity can increase an individual's total energy expenditure and even help them lose weight. Weight can also be controlled by anti-obesity drugs. Doctors usually only prescribe these drugs if a patient's BMI is 30 or higher, or if it's 27 and higher, but they have a condition that can be related to their weight, such as type 2 diabetes or high blood pressure. Kismia is the most effective weight loss drug to date, and it works by lowering appetite, and it must be paired with physical activity and a low-calorie diet for chronic weight management. Another treatment modality is bariatric surgery. Both banding and bypass procedures have increased in popularity. The surgical procedure works by shrinking the functioning volume of the stomach and creating malabsorption. Bariatric procedures also reduce the circulating levels of ghrelin, which is the hunger-stimulating hormone produced in the stomach. Lastly, behavioral modification can be used for those who are overweight or obese. The purpose of behavioral modification is to change behaviors that can contribute to obesity. These therapies usually include 1. Developing a specific and realistic goal that can be easily measured, 2. Developing a reasonable plan to reach that goal, and 3. Making incremental changes that can promote positive experiences that can be used as a foundation to make additional lifestyle alterations. Behavioral modification therapy is low cost and non-invasive. Behavioral modification treatments are typically conducted in small groups and are available at most local hospitals. These therapies require time and commitment on behalf of the patient and their provider. However, it's important to note that intentional weight loss programs are not sustainable. The major limitation of these programs is the likelihood that an individual will regain weight once the treatment has ended. It's important to consider these treatment modalities as obesity affects all countries across all boards. As you can see on the chart, underprivileged countries are more at risk for obesity than their more privileged counterparts. In addition, obesity is higher among Black women than white women, and those below the poverty line are more prevalent for obesity. We wish to curb these disparities, which is why my colleague Aditya will be talking about the app that we are making.
Thanks, Amrutha. To combat these cardiovascular threats and the disparities, we are introducing the Curb app. The Curb app is an uplifting, holistic, lifestyle-type application that is built to form a community. The app centers around a social media-type aspect where members can share recipes and meal ideas on a platform that anyone can see. This app is a system that is promoting a sustainable, complementary way to fight fast food habits. We have a recurring point system in which members can keep posting and build points that they can then redeem at nationwide gyms like Planet Fitness and grocery stores like Whole Foods. We also have an aspect of pricing. We want to show how it's not much more expensive to be healthy, and therefore participants can add in the total cost of the meal to show that. By using the Curb app, we want to push the community to embrace a healthier lifestyle to decrease their risk for cardiovascular disease. Join us and Curb to improve heart health.